one part of my practice that I enjoy is trying to help people solve problems with implants. Most of the problems we have with implants are actually with the teeth on the implants. If it's an older implant, sometimes the parts are not available. If somebody's used an implant that is not from one of the top 10 companies, not one of the international companies, then a lot of times after a couple of years you can't get the parts anymore. And so if the tooth breaks off or if the implant has problems, you've got to find a way to help that patient use those implants. And we've got several sources that we look at to try to help people do that. Sometimes we have to put in additional implants to reinforce the implants that are there that were placed years ago that aren't as good, aren't as designed as good. But we have many options that we use.